going to be flipping back and forth between these two guys. So basically, starting day 1, right, the ovaries start to produce estrogen. That causes the thick mucus in the cervix, which is like right here. That causes that cervix to thin out. So the mucus there to thin out, which essentially allows the sperm to get in. So the sperm would come up through the vagina, in through the cervix, and into the uterus, and that's where fertilization would happen. And so the ovaries, the ovaries are producing estrogen, and the estrogen starts building up. It causes the egg to release at ovulation, and at the same time, it's also feeding nutrients into the walls of the uterus, which is where, if the egg was fertilized, it's going to implant into the wall of the uterus and start to do whatever they do. Right, so after ovulation, the lining is maintained, but your levels of progesterone are going to grow, and that's also comes from the ovaries, I think. So the egg is released from the ovary, and then flows through the fallopian tube. Lining maintained, right? And then so if fertilization doesn't happen during this period, then your levels of estrogen and progesterone are going to start to fall. When they start to fall around here, day 28, that's when the lining breaks down, and that's what, and the lining coming out of your vagina is what we call a period. So, and then the cycle starts all over, where estrogen starts to build, and then all that good stuff. So usually this will last like around 2 to 10 days is like your range, and around 3 to 7 is where most people are in terms of how long there's stuff coming out of your vagina. Okay, so just for a quick like tip,
do tell.
Levonorgestrel is a special kind of progesterone, and if I forgot to mention it, progesterone essentially will rebuild that mucus that's right here in the cervix. So levonorgestrel is a special kind of progesterone that's in some kinds of IUDs that essentially keeps this mucus really thick and prevents sperm from getting into the uterus. So menstrual care, 3 basic kinds. We have pads, tampons, and menstrual cups. So pads line the inside of your underwear, and you should change it anytime it feels like wet or uncomfortable, but 8 hours is like around your minimum of like you're gonna be changing it. Tampons, some are inserted with fingers, others have an applicator, and you have to change that like every 48 hours. Really, really bad if you don't change it because of toxic shock syndrome. And if you have a heavier flow, then you're gonna wanna be changing it more often. Menstrual cups are made of plastic or rubber. I just have a big that guy in the background. Menstrual cups are changed every 8 to 12 hours. So that can give you an advantage, right? If you don't want to change it as often, so maybe when you're sleeping and something like that. Some of them are reusable, like you can wash them out, and some of them are disposable. So common symptoms of periods include cramps, breast tenderness, headaches, dizziness, nausea, diarrhea, like pretty much can happen. Cramps, things that help with cramps include like over-the-counter pain medication, like a hot pack on your uterus, and then also exercise helps, and orgasms help with cramps. So PMS stands for premenstrual syndrome, which is essentially something that can happen to some people before and sometimes even during the period. And it's like emotional and physical symptoms that are going to show up, like mood swings, tension, dizziness, anxiety, things like that. Some people that happen with every period, some people that only happen occasionally. It really depends on the person. And so one of the ways that you can, like if a student comes up to you and they're like, I'm having a lot of problems with my period, one of the things that they should be looking into if they have a really heavy, uncomfortable flow, but they have a lot of problems with cramps, one thing that can really help is hormonal birth control. So classic, your standard, like the thing everyone thinks of when they think of the pill is 21 active pills, which contain some sort of mix of progesterone and estrogen, I think. I'm not sure. Yes. And 7 placebo pills. And essentially you take the 21 active pills, and then you take the 7 placebo pills. And then you get your period during those 7 days of placebo. But nowadays there are other options when it comes to birth control. So one example is seasonal, which essentially you take 3 months of active pills and then 1 week of placebo pills. And that means essentially you're getting your period 4 times a year, every 3 months. And it depends on, right, you take these it depends on when you take active pills. So you can even, there's some birth controls where it's continuous. You take active pills all year round, and you'll either get your period once a year or not at all. So people ask, I'm told, that on the Planned Parenthood website, they said people always ask about this. Can you just use like a regular pack of birth control? Can you just keep taking those and that works? The answer is yes, it does work, but don't do it. You should like talk to your doctor when it comes to like birth control decisions, because dose and regularity are like really different for different people, and it's important that somebody's watching that. But it's totally, like, in general, it's fine to just keep taking active pills and you just won't get your period. Some people, so 2 weeks after stopping birth control, that's about the time when you're gonna start ovulating again. So it takes about 2 weeks from when you stop taking birth control until you will ovulate. That said, that depends on what kind of birth control you're on. That's just the standard one. So Plan B, right? Plan B we talked about at a different time, is essentially, right, you have sex, you didn't use protection, and you're worried about getting pregnant. You can go to the store and buy Plan B, and that's what you should do. If in an emergency, you can also just take a bunch of active pills from like a normal birth control. Don't do that without consulting a doctor, because again, dose and all these sorts of stuff are really dangerous, but it's theoretical, like it works in theory. So just some other things. Mirena releases progestin, and it makes periods less frequent and sometimes stop altogether. Shot also has fewer and lighter periods. The implant is really interesting. For most people, it's fewer and lighter periods, but in some people, it has heavier and longer periods. And then vaginal ring will cause most people spot or bleed for 6 months after putting it in, but then after 6 months or so, it'll stop. So that's all I've got. I have a few other assorted questions, but I would love to hear Ahmed's.